Hi, I'm Dr. Raghu Athre with Athre Facial Plastics in Houston, Texas. I am a double board certified facial plastic surgeon specializing in facial rejuvenation. Due to the fact that I do a lot of facelifts and specialize in facial rejuvenation, I get a lot of questions about facial rejuvenation. One of the most common questions that I get regards healing after a facelift. The question is how long does it take? So let's start with a little bit of introduction to this first. So, what I notice about most of my patients who come to me for a facelift is they're working, they have responsibilities, they want to get back to being normal as soon as possible. I think there's a lot of information in the past from facelifts done in maybe the 60s and 70s and early 80s where patients had months or 6 weeks to heal after surgery. There's even some of my mentors prior to me have told me that they used to keep their patients in the hospital for a few days after a facelift. Well, those days are gone and aren't coming back. So, how do we get from here to here to here in the fastest possible way? So today's patient needs to get back to being normal and being able to do all the things that they need to do as soon as possible. So when a patient or someone online asks me this question, let me first start with what my generalized response is. My general response is that it takes about 9 to 10 days for a patient to look normal enough that they can wear makeup and go out and about and look normal and conduct business and do the things that they need to do. That may not be their final end all result. However, from a distance of sitting across a dining room table, they'll look pretty normal to their friends and potentially their coworkers. Now, this information is based on a couple of different postulates and things. Okay. So, first of all, my patient needs to be healthy. For example, if I have a patient who is on blood thinners or things like that due to chronic medical problems, this same timeline may or may not actually work for them. Their timeline may be a little bit longer. So, this is kind of one of the main reasons that the consultation appointment and the preoperative appointment are extremely important. So, what actually happens during those appointments, during my initial get to know you consultation, is that I'll ask you questions about your medical history and medications you may be taking. So, on the on this side of the table, what actually I'm doing is processing that information and figuring out whether or not there's any additional information I need to be giving my patient, or if there is any things that I need to do. For example, I had a patient who has had a kidney transplant. So when I elicit this kind of information, I go, okay, this requires a little bit more work. I need to be able to talk to her doctor, figure out what medication she's on. I need to figure out whether the surgery is safe for the patient. I need to figure out if there's any changes in the medications, the dosing schedule, all these different kinds of things, and what potential interactions that those medications may have on the medications I need to give her for surgery. So all of this information is put together and then is kind of checked off at the preoperative appointment so I can give the patient a better idea of what her postoperative time course will look like. However, my run of the mill patient who's healthy, not really taking any medications, has no medical problems, I think that the 9-day time course is a pretty realistic time course. Next, the next major variable that kind of dictates the time course of healing, in my opinion, I don't have scientific evidence in terms of literature to support this, is the anesthesia type. Now, for a facelift, or if we're doing full face rejuvenation, we have two potential anesthesia types. Most surgeons like to use general anesthesia or some version of general anesthesia. I like to use local anesthesia. This is something that is kind of unique to me in my practice. I really enjoy doing it this way. However, I feel that the local anesthesia does give you a faster recovery period with less bruising and swelling. Now, that statement that I'm making is based on my experience of doing thousands of these facelifts under local anesthesia. However, I can take that statement and back it up with a little bit of science. I think the reason this happens is for a couple of different reasons. Number one, the local anesthesia medications do not cause vasodilation. What is vasodilation? So, vasodilation means blood vessels opening up. So, a lot of the medications that are used in general anesthesia, a secondary side effect of those medications is vasodilation, meaning that blood vessels can open up. As those blood vessels open up, you're going to have a little bit of bleeding and a little bit of bruising. Secondarily, I think that the general anesthetic medications also give you a little bit of brain fog and a little bit of not being able to get back to complete normal faculties. So that delays the patient from being able to get up, being able to ambulate, being able to walk, so on and so forth. The combination of those two things, the vasodilation, which leads to bruising and swelling, as well as the delayed ability to ambulate and get back to normal, I think kind of increases the recovery time. I've done a study on this and I'm presenting this on several papers that I have found that my complication rate is lower and my ability to get patients to get to walking and back to themselves is lower by using local anesthesia. So, next down the protocol of things that I do in order to get patients up and at them as quick as possible. So, I think that the entire recovery process is as important as the surgical process. You can see that there are things that we're doing in surgery. For example, the anesthesia type, there's even techniques that I use in surgery. All of these things are being done for one reason and one reason alone, which is to get my patient to get the best result, but in the quickest possible time. Okay. I don't want my patient to have a 6 week or 8 week or 3 month recovery period. I want my patients to be able to get up and at them much more quickly. A good example of this, one of my patients is on video. She works for the TV station, and she gave me a time frame of 10 days off, and then she wanted a facial rejuvenation, and she wanted to be back on camera in 10 days. That's the only time that she had allotted to do this procedure, and we came through on that. So I do think that taking the time, energy, and effort to really kind of micromanage all of these things do pay dividends. Now, so what do we do so weird or independent or unique that allows us to do this? So there's a lot of techniques in the operating room that I'm doing. We talked about the anesthesia. We talked about preoperative consultation with respect to medications and medical issues. Now, postoperatively, there's a lot of things that we're doing. So, number one, we're doing is in the operating room, I'm using a lot of quilting sutures, which decrease the dead space, thereby decreasing the amount of space that fluids and blood can collect in. Number two, after surgery, we do have a compressive dressing. This is something that a lot of surgeons do. Now, here's what makes us stand out. Postoperative day number one, I'm doing a proprietary IV cocktail. This has got a lot of stuff in it to really help your body's natural systems heal as quick as possible. Number two, we do Elixir, which is a high intensity LED photobiomodulation. A lot of fancy words. Basically, it's LED light to help you heal as quick as possible. Number three, we're doing hyperbaric oxygen. All of these things put together, I call it kind of the Wolverine protocol. It's doing everything I potentially can in order to get you to heal as quick as possible. Lately, we're seeing patients being able to get up and at them and doing everything that they want to do by about 8 days post-op. So I'm going to give you a little time-lapse photograph of one of these types of patients. She's a healthy patient. She wanted a full face rejuvenation. We did a full face rejuvenation under local anesthesia on her. And I just kind of wanted to show you kind of a time-lapse view of what she looks like. And here's what she looks like on post-operative day number one, immediately after the dressings have been removed. You can kind of see the quilting sutures still in place. There is some very mild bruising of the tissues. Then as we follow her along, we see her on post-operative day number three. Quilting sutures have been removed. Now, she also had a chemical peel at the same time. You can see that the old skin is sloughing off. This is that darker brown area that we're seeing. You can see the underlying new skin. Now, this Wolverine protocol is relatively new in my office, and initially, I was seeing this type of pink skin reepithelialization roughly at the postoperative day number 7 to 10. And here we are at postoperative day number 3, and we're already seeing that nice pink skin reepithelialization. Moving along, here we see her at postoperative day number 5, and kind of quickly flipping through, we see her at postoperative day number 8. By this point in time, she does still have some swelling in the tissues. However, she is capable of wearing makeup, letting her hair down, and going about and doing all the things that she needs to do. So I think that this is a very interesting and cool to be able to provide this level of service and be able to get these patients to get back to their normal routines as quick as possible. There is a very, very, very important caveat that I want to include here. Number one, we are not changing the amount of surgery or the depth of surgery or all of those various things. So, for example, if a patient needs a deep plane facelift and a deep neck lift with submandibular gland resection, kind of the full on Monty, we are doing the full on Monty. We are not doing less surgery and saying, hey, look at our patients. They're recovering quicker. This patient, for example, had the full Monty. She had a deep plane facelift. She had fat transfer. She had a deep neck lift. She had a chemical peel. She had a submandibular gland resection. So there was a lot going on. So we did not skimp on the surgery just because the patient needed to get up and at him quicker. So I think this is a very important caveat. So I hope this video has been extremely useful and you learned something from it, and it answered some of your questions about recovery from a full face rejuvenation here at Authray. If you have questions about this video, please leave us a comment or get a hold of us via email or any of the other modalities that are available, including direct messaging and all the such. One of the things I would really, truly appreciate if you could do is please hit the subscribe button or leave us comments about this video. It really gives us direction on some of the future educational videos that we produce. Thank you so much for watching. Dr. Raghu Authray with Authray Facial Plastics in Houston, Texas.